In just the past hour, I spoke with UCSF infectious disease expert Dr. Monica Gandhi about how to stay safe during holiday gatherings and the second COVID treatment pill that just got the green light.
Yes, the one that was just approved today, the Merck pill, is called Molnupiravir. The Pfizer one's called Paxlovid. We need a little bit of time for that, but it's going to come out. Molnupiravir is a nucleoside analog, and what it does is it essentially prevents people from going into the hospital by 30%. So not amazing, but still a huge improvement by 30% if they're unvaccinated. That's what's been tested. Unvaccinated people at risk for being hospitalized, 30% reduction in hospitalization and death. Paxlovid was 90%, so higher than that.
Right. So is this going to be ready to be distributed right away, or is this going to take a little bit of time like Pfizer's?
So this particular one, they say, is ready to be distributed. And the reason that's important is the CDC just released new data just today that it looks like if you're unvaccinated, you're 70 times higher likely to be hospitalized than if you're vaccinated. I mean, that's how high that number is. So we have been waiting for that data for a bit. So if you're vaccinated, you're really going to be likely not in the hospital. But if you're unvaccinated, we need treatments for them.
So if say you're not vaccinated, you get diagnosed with COVID, the doctor prescribes you this pill, it's as simple as going to a pharmacy or them handing it to you, and there you go.
Yes. 5 days, oral, twice a day, way easier than monoclonal antibodies, which actually had to be given subcutaneous or intravenously and much harder to do.
Yeah, it sounds like a lot of these treatments are getting much easier. All right, with Omicron taking over and case rates quadrupling in some areas, the stats sound alarming. I mean, we're looking at New York City right now, and you know, we've seen over the past 2 years, we're usually like a couple weeks behind them in terms of case rates in our surge. Can we put this into perspective, though? I mean, are we back to March of 2020?
No, not at all. Because what happens is that cases are going up. Actually, Omicron is very transmissible, 4 times more than Delta, probably, by a Japan study. But what's happening is that the hospitalizations are staying very low. That decoupling that we talk about, where cases are high but hospitalizations are staying low, is very prominent in highly vaccinated regions like the Northeast and California. Actually, just wrote a Washington Post piece today that says, this is what it looks like at our hospitals. It is looking like cellular immunity is working against Omicron.
What if you are fully vaccinated, you're from the Bay Area, as many of us are here in this particular region of the country, but you're flying across the country to, say, someplace in the Midwest or the South where you know that the older people there are not vaccinated. You're going to be seeing cousins and uncles and aunts that are not vaccinated. What's your advice there? Should everybody be tested? Should you be wearing a mask?
You know, if they are willing to be tested as the unvaccinated, that would be really better. You are unlikely to spread it to them if you're feeling fine. I would kind of have ventilation going. It's very hard to mask in a family gathering. Let's be honest, people are eating. I'd have ventilation going in that setting because ventilation is an underappreciated and amazing mitigation strategy.
Dr. Monica Gandhi, thank you so much. Happy holidays.